Hello, everyone, and welcome to our casual coffee chats where we give you a sneak peek of our presenters, their topics, and what you can expect from their presentation at the largest annual Canadian Holistic Conference. Our conference this year is held on May 13th and May 14th with the theme of it being immunity, unleashing your natural defenses. It is my absolute pleasure today to be joined with Dr. Isaac Eliaz. Thank you and welcome so much for coming with us today.
Thank you. Thank you for inviting me. I'm really excited about the conference and about the topic. It is such an important topic.
Yes. Now, your presentation topic for the conference is the survival paradox, balancing the immune system in challenging times. Can you tell us a bit about why you're so passionate about this topic?
Yes, of course. The survival paradox is really a term that represents decades of my studies. In my early 60s, I've been doing integrative medicine with focus on integrative oncology for over 30 years. I'm also a licensed acupuncturist, trained in Chinese medicine. So I'm really vertically trained, but I also spent decades training in meditation and healing, being the doctor of some of the most legendary meditation masters in the Himalayas and learning from them. And all of these esoteric studies, being a clinician, being a healer, and being an active researcher with publishes a lot of peer-reviewed papers, having NIH grants, brought me to this simple but profound understanding that our survival drive, which is built within every cell in our body, is also what drives chronic diseases, aging, and really every disease. And while understanding this clinically, conceptually, I'm also the lead researcher and clinical researcher around a protein called galectin-3. Galectin-3 is our survival protein, but also it's the main driver, the initial driver, the upstream driver of inflammation and fibrosis, which drives every chronic and acute disease. I've researched on sepsis, on acute kidney injury, and I do work on cancer, and I do work on microbiome, on different fields. So this understanding is especially practical for the immune system, because a balanced immune system is not necessarily just a strong immune system. A strong, imbalanced immune system can be deadly. And the cytokine storm that we are all aware of, and which has been the foundation of my work for decades, a lot of the discoveries, have been mine, is we now know it, we all know it, that it's really the immune response that causes the disease. So in the conference, I will explain the concept of the survival paradox, the understanding that not only we want to survive, the virus also wants to survive. So the spike protein of the COVID, for example, if we look at the COVID as an example, is almost totally identical to galectin-3, our survival protein. So how do we balance the immune response? From a nutritional point of view, from a supplement point of view, I developed the first commercially available natural galectin-3 blocker, modified citrospectin, but also mentally, spiritually, psychologically, in our lifestyle. So we can create a holistic approach where we don't just look for one solution, but we have a guiding answer, and then we have lifestyle. And this is really what guides a therapeutic approach that can be very, very profound.
And you mentioned nutrition. So obviously as a large group of holistic nutritionists, we're very excited to learn from you, what we can take and really apply with our clients in our practice. So in your presentation, can we expect some practical kind of takeaways that we can use in our practice with our clients?
Absolutely. I am highly practical. Yeah. My life partner, my wife, is a registered dietitian from Israel from the 80s. So nutrition has been the basis of our life for decades. We appreciate it. It's interesting as an anecdote. When I was in medical school in Israel, like in my final years as an intern, I was the favorite person of the nutritionist and dietitian. I was the only one who was paying attention, you know. Finally, there's somebody who can support them, and we would figure out how to go around the other doctors and explain to them how important it is. Of course, now there's much more awareness, there's much more data, but there is still not enough appreciation that what the quality of fuel that we put in our body definitely affects what we do. And in this sense, in the lecture, I will cover nutritional issues, supplement issues, and also issues of what constitutes clean food. I mean, organic is important, but it's not enough. You know, we are facing a slew of issues with pesticides that are in every field, heavy metals, you know, and mycotoxins that are also growing on certain foods. So how can we address it when we give nutritional advice to our patient, to our clients, and how we make this as part of a bigger package? Because not only what you eat, it's how you eat, it's when you eat, it's where is your mind where you eat, where is your heart when you eat. These are very, very important advice, and I know from Gili, my life partner, who had this amazing successful nutritional practice in Israel in her 20s, you know, without a business card. She understood the psychology of the person, how to get them to eat the right food. So I think nutritionists have this profound tool, because we all have to eat in order to live, you know?
Yep.
So it's not like we have to do something that is out of the ordinary. How can we get people to make the right dietary choices, to eat in the right way, to eat in the right time? And all of this is part of the survival paradox, because when we come out of survival, we react with the sympathetic nervous system. That's our immediate response, and we balance with the parasympathetic response. And then we have the biochemical changes. So I will cover all of this so people can understand it. But my theme, my working life is I can have a very global, big understanding, but I'm very, very practical. You know, I'm a formulator. And I work with patients and I teach. So yes, it's going to be a very practical lecture, definitely.
Wonderful. So it sounds like we expect a lot from your presentation. So lots of research, lots of your experience, lots of things that we can take with us around nutrition and lifestyle and mindset. Anything else that you want to add that we can really expect from your presentation this year?
I think that within the limited time that we have, and I can follow up with more information afterward, to really understand the opportunities that we have in working with other people to affect their life, to affect other people's life. And so if our starting point can be from a place of spaciousness and not from a place of survival, of contraction, if we can create the space to allow the patient, the client, whatever the terminology, to be themselves, to express themselves, and guide them and empower them, we'll get much better results and with much less struggle. So it's really in these days in life when there is such a struggle, you know, so much that these last 2.5 years and the traumas around it and the violence in the world and global warming, I mean, you just name it, you know, it's all a reflection of abnormal inflammation. What is global warming? It's inflammation, it's heat. How can we chill? How can we cool? How can we nourish? How we can connect? And food is one of the most beautiful ways of doing it. You know, there are cultures that spend hours eating together or having a cup of tea. The value of tea at the end of a meal, well, it has some nutritional effect. You know, it warms the digestion, it clears what Chinese medicine will say is phlegm, it will help some digestive, and then, but also allows us to just take our time, give dedicated time to digesting. You know, people have no time to eat. You know, the research now shows a family that has one weekly meal together is much healthier, even one weekly meal. So yes, these are very, very powerful basic tools, and they are really the foundation of health. So that's why I'm always excited to talk in front of such an audience. And it's one of my most favorite audiences because it has been with me for almost 40 years. So it's a long time.
Well, we are very excited to have you, and you guys definitely want to make sure you do not miss this presentation. Now, before we let you go, we always love to ask each speaker if you have maybe a hidden talent or one fun fact about you that maybe we don't know about.
Oh my gosh. And you know, I have a few things that I don't know why I did them, but one of the things that I don't know if it's fun, but I really like,
Yeah.
which connected me with nature, is I started raising bees at the age of 12.
Oh, wow.
I would like a registered beekeeper at the age of 12 in Israel. And I'm now picking up bees again as a way of supporting the environment. So I'm getting my 5 new beehives in a week, and I'm very excited.
Wonderful, wonderful. Well, thank you for sharing. Thank you for spending your time. And remember, everyone, you can still get your tickets on sale at CSNNAA.org. So make sure you get your tickets because you're not going to want to miss this presentation.
And
Thank
maybe
you so
if
much.
I want to add one thing,
Mhm.
people may enjoy if you pick up my book, The Survival Paradox, and read it. It is a transformative book. You will see from the reviews, it especially for health providers and for people who have been sick themselves, they say, wow, my whole understanding of health has shifted. So if you read it before the lecture, then what I explain will resonate in a deeper way. Especially if you don't have a lot of time, read the first few chapters and then read the 3 last chapters, how to transform the survival paradox.
Wonderful. Well, we'll put that link below so everyone watching can click on the link and go and get that book. That's wonderful. Thank you so much for your time today.
Thank you for having me. I'm excited.
Yes, thank you.
Bye.
See you later.